Greetings from Aster RV Hospital. I'm Dr. Ambika Prasad, consultant anesthesiologist here, and today I'm in conversation with Dr. Divakar Bhat, senior cardiothoracic and transplant surgeon with almost 3 decades of experience in this field. Welcome, sir.
Thank you.
Firstly, the reason for this podcast, exciting news. Aster RV Hospital, under the able guidance of Dr. Divakar Bhat, is organizing its second edition of its heart-friendly marathon, Heartathon, on 28th September 2025. Up to you, sir. What is this Heartathon that we're all excited about?
Yes, Dr. Ambika, this is really exciting for us to announce that we are coming up with the second edition after seeing the real great success of first event, Heartathon. Heartathon, as I keep telling, it's a marathon for your heart. Marathon is synonymous for a hard work, persistent work, dedicated work for anything. So when we are doing something for our heart, we have labeled this as Heartathon. So I have mixed the word marathon and heart. So the first event was conducted last year from Aster RV Hospital side, and more than 1,100 people participated, and it was a huge success. And many of my friends kept on asking me, when is your next event? It was such a huge success. So that made us to take up this responsibility, and this event is basically conducted to bring awareness among the public about the increasing heart problem. We are losing many young lives. We see in the news every now and then. So the idea is to bring awareness among the public, to involve people more and more in physical activities. That's why we are conducting this Heartathon.
So we often hear the term marathon. How did you coin this term Heartathon?
Yeah, it's very interesting, and many people sort of get confused. And this word itself sort of interests you, the Heartathon. As I told, it's a combination of heart and marathon. I, being a cardiac surgeon, I always believe in physical activities, and for last 10-15 years I am involved in running activities. So I thought, being a cardiac surgeon, why should not I take up some initiative to bring down the heart diseases? So that's when I thought, let me conduct one marathon event for the sake of heart. So that made me to sort of combine these two words, heart and marathon. That's how probably this is a marriage of heart and marathon. The child's name is Heartathon. The idea is to bring down the heart diseases, or to prevent many unnatural deaths in young individuals. That is the main purpose of this event. So that's how this terminology has come into existence, and probably if this gets popularity like this, one day we might add this word into dictionary.
That's what. So when you say Heartathon, sir, compared to a regular marathon, are there any differences in this event that we should look forward to?
Yes, there is a lot of difference. Actually, a marathon means it's a long distance running. To be precise, it is 42.2 kilometers of running is called a marathon. Whereas for people convenience sake, now several marathons are conducted with a distance of 10 kilometer, 21 kilometer. 21 kilometer is called as half marathon. 42.2 kilo is called as full marathon, and for general convenience sake, they are making now 5 kilometer and 10 kilometer distance also. As I told you, the idea of this Heartathon is to sort of impart the knowledge of heart to people. So the ideal heartbeat per minute is 72 per minute. That's why I thought I'll keep 7.2 miles as the distance for Heartathon. So this we are calling it as strong heart run. So if someone wants to run and prove their heart is strong, they can take up this 7.2 miles, which represents the ideal heart rate, and this is one event. The another event everyone cannot run 7.2 miles. That comes to around 11.6 kilometers. So for them who are not able to run this, the lighter option would be half Heartathon. This I call it as healthy heart run. So for those who cannot run the full strong heart run, that is 7.2 miles, we have made the lighter option of 3.6 miles, that will become 5.8 kilometers. So we have already identified the running track for all the runners, which will be in and around our Aster Hospital, JP Nagar residential area, less turns, very surrounded by trees, early morning. It will be a fantastic run, I can assure you.
So as I understand, we are doing this Heartathon in association with the World Heart Day, which is from the World Heart Federation, which is every year on 29th September.
Yes.
And this year's our Heartathon is on 28th September because it is a Sunday. Every year there's a different theme, and this year's theme is Don't Miss a Beat.
Yes, exactly.
What does it mean, sir?
Yeah, as I told, World Heart Federation started conducting this World Heart Day. Like there are so many days are celebrated all around the world, and to bring the awareness among the public, the World Heart Federation thought we must dedicate one day in the entire globe, and that is happened to be September 29th. But this year it falls on a Monday, and for people convenience, we are taking Sunday as World Heart Day for us, and that day this Heartathon will be conducted. The theme is every year we are slogan, we can tell. Every year it will be different. It's once again to bring the awareness about the heart diseases, and as we all know, missing the heartbeat is if your heart does not beat for maybe few seconds or 3 minutes, it is our soul would have reached
Of course.
up. So the idea is that should not happen. That's why we have made this as a slogan: don't miss your heartbeat. So to keep the heart ticking, the easiest solution is being active. Do some activities. The easiest activities is probably running, walking, brisk walk, jogging, something like that. So that's why we are taking this. And in fact, in our all T-shirts, every runner, this slogan will be depicted on the behind, and so that everybody will know the importance of each heartbeat. As you know, the heart is one organ which will never take rest. You know, it starts beating from 21st day of our life inside the uterus, and this is the last organ to stop. This organ will work without holidays, and every day it works, day and night. That is the theme this organ is giving to the entire population or entire globe, that it is the one which works every time, every second. That's why don't miss the beat.
Sir, as you rightly said, the organ that does not stop. So it is our job, I believe, to keep it healthy and functioning at its best. Especially now that heart disease is affecting younger population, maybe due to the rising stress, poor diet, lack of physical activity. What would you suggest, sir, to bring about awareness about taking care of our heart?
Yeah, the first thing I tell as a specialist, one who deals with heart diseases every day and try to correct heart problems, is listen to your body, listen to the nature. These are the two sentences I keep telling. And don't have stress in your day-to-day life. Take the things as it is. Have adequate sleep. Eat natural food. Be friendly with your friends. Don't indulge in drug abuse. Don't indulge in alcohol, smoking. And if you happen to get diabetes or BP because of your ancestral property, try to control them. So these are simple things. See, heart disease is not complicated. It is how we have. See, I'll tell you, everyone is born with the same heart. We are all born with the same heart. The same engine works differently after 20 years, 30 years in different people. Why? Because we don't know how to take care of this heart. When you buy a two-wheeler or four-wheeler, you take it for checking every now and then, every 6 months or every year. Whereas with our body, every time we have to use, every day we have to use. We don't do a regular health checkup. So that is another advice I keep telling. So don't avoid stress, listen to nature, listen to your body, even the smallest complaints which looks not normal, take medical help and have regular health checkups. And with the simple methods, probably you can prevent many sudden deaths.
So just as you gave us a few things to take note of, like eating well, avoiding alcohol, tobacco abuse, promoting early health checkups, managing existing conditions, I want to ask you, what is eating heart healthy food?
The healthy heart food is basically less fat, less salt, and avoid junk foods. Eat a lot of vegetables. I told you, nature friendly foods. Nowadays you see this fast food chains every corner, and everyone is getting easy access to the junk food. So avoid fried items, avoid oily items, and smoking should be completely avoided. Alcohol, drug abuse if you have. So eating natural food is probably the mantra for heart.
I'm sure looking at our podcast, there are going to be many people wanting to come and run for our Heartathon.
Yes.
For the
That too after seeing last year's success, and
Yes.
And last year our the finisher medal was so unique. There was so much demand afterwards, and I had difficulty in answering them.
Of course.
Yes.
So for our audience to know, can anybody come and run a marathon? Or is there some preparation required to run?
Yes.
More importantly, who can run?
Yes.
And what do they need to do to know whether they can run a marathon or not?
Very good question, because the enthusiasm suddenly might lead you into trouble. Yes, many people are running, and one should not start running suddenly. That's my advice. If you are already running, yes, you can definitely participate in this without any. You will come and enjoy, sure. But if you are not run so far, my advice is do some practice. Maybe initially 1 or 2 kilometers, then slowly bring it up. And whoever has got 2 legs and 1 heart can participate in this, because compared to all other running events and marathons, remember you are running around the hospital, and there will be enough doctors among you running. Okay, there will be at least 200-300 doctors in the marathon Heartathon event in this, because this is happening around Aster RV Hospital. So don't worry about the emergencies, something which happens. However, due precaution is must. If you have diabetes, if you have blood pressure, have a thorough checkup before registering. And if you have any unusual health issues, please make a note and when you are registering. So these are the precautions. What you need is just pair of shoes and a strong mind, strong will. First decide to run. You will come and enjoy. And next year I'm sure you will be definite participant.
And I'm sure even this year we can run at our own pace.
Yeah.
I understand there are a few categories that you have given about running within specified times.
Yes.
But we can also run at our own pace and finish this Heartathon. Sir, emphasis on simple physical activity. Most of us have sedentary jobs, sitting most of the times and getting exhausted mentally. Anything that you can suggest that can give us physical activity without changing our routine, and yet incorporating physical activity which can help us take forward?
Probably, I think you must have noticed me climbing 9 stairs on the ramp every day. That's why this question. Avoid lifts. Simple, say, I'm sure many of us are working in big offices or big buildings, and Suppose you have to go to a market which is just hardly a kilometer or so. Don't use two-wheelers, don't use auto, go by walk. And if you are working in an office, avoid lift, take a ramp or take steps. And when you are doing a continuous desk work, take a break every half an hour, take a small walk. So these are small tricks which will definitely keep you mentally awake, and physically also all the joints will be very active. And it's not that every time you should run around. Maybe the recommendation is any hard physical activities 3 or 4 times a week, not more than that, maybe 30 to 40 minutes. It is only for professional runners. Remember, this event is not for professional runners. However, professional runners are welcome here because I'm sure you will enjoy the atmosphere and crowd. But this is to bring the awareness. This is for common people. This is for someone who wants to start physical activities. So anybody can do this.
So, sir, every week we get an update saying there's a marathon here, there, especially in a city like Bangalore.
Yeah.
What is different in this Heartathon and what is in it for us, the runners?
Very good question. When there are so many events happening, why someone should come and participate in this is a question. My first answer is, remember, this is for your heart. Something special you have to run. And as I told, distance is unique, 7.2 miles and 3.6 miles. You will find it really interesting. And this is a timed event. You will be given a timed bib. And just to encourage, don't take this as a challenge. If someone runs 7.2 miles in 72 minutes, once again I'm stressing because this is ideal heart rate, they all will be recognized. And similarly, the half run, healthy heart run, 3.6 miles, if someone finishes in 36 minutes, you will be recognized. So this is unique in many ways. And this timed bib, probably many may not be used to it. Your bib will have a special chip, and there are mats along the running track. So those mats will recognize when you cross those running mats, and time will be told exactly. And this will be very interesting and encouraging for you to pursue your dream. Then everyone will be given a special t-shirt for running, and which will have a slogan of World Heart Day printed on that, and you will be running with the timed bib. Then every finisher, whether you take longer time, once again I'm telling, don't worry about the time. You are running this or you are participating in this to get knowledge about the heart. That is the main motto of this event. So all along the track there will be placard. You will get so many knowledge about the heart. And the finisher medal also will be unique because it will look like your own heart. You will you can keep this as a memento, and you can always show it to your friend and boast that, look, I have run for my heart and this is a proof. And this year, very unique 2 events we are doing. Every participant will be given training in basic life support. We will tell once again about this when participants come and learn this technique, why it is important, because I am sure every one of us will see someone dying in front of us one day or the other day in our life. If we know a simple trick of saving his life, why not? So many lives can be probably saved. So this technique we are teaching to all the participants, those who are interested, and everyone will have an opportunity to pledge their organs after their death. Organ donation pledging option we are giving this year. And of course, when you take so much pain and run and exhausted, healthy hot breakfast will be waiting for you like any other. So this is unique in so many ways. So I encourage many participants this year to come and take benefit of this event.
Forget chocolates, forget sweets. Running and exercise increases endorphins, which are the happy hormones. We are going to be running, waiting for you.